Most migraine patients have this kind of confusions that in spite of me taking so many treatments, in spite of me going to so many doctors, so many specialists, and even trying so many home remedies, why this migraine keeps recurring. Most of the patients tell me that I went to a doctor and he told me that stress is the cause of your migraine. And they told me that your diet is a issue for migraine, and you're having sleep issues, or you're having food delays, or there are some other factors or triggering factors which they are connecting with migraine. Patients tell me that I've been trying to avoid all these things. I've been choosing some diet patterns, I've been choosing some sleep patterns, I've been choosing some emotional things, and I've been avoiding stress factors. I've been trying to do all these things. In spite of all my efforts, and in spite of all the efforts that neurologist or my doctor did, migraines keep recurring. And why is that happening? So this often leads to more than a confusion, a chaotic stage, in a migraine patient's life. And also this chaos will, reverberate or spread to the family, spouse, and kids. And they are like perplexed. How can we help this migraine patient? How can we help her to regain back to her normal life? We have to understand that migraine is not just a physical disease. Migraine is a psychosomatic illness where it has multiple layers. So just like I always tell an example, like when we take a burger, we see that there are two, layers of fatty, or one layer of fatty is there, and two layers of breads are there. But some kind of burgers have maybe one layer of cheese, maybe one layer of mayonnaise, maybe one layer of veggies. There are multiple layers for multiple types of burgers. Similar to that, every migraine patient has individualized layers. Generally, when we talk about migraine, we can see that there are at least about 3 layers of migraine. What I would call the first layer, or the tip of the iceberg, is a migraine layer, or the pain layer, where you have all the symptoms. You have issues with sunlight, you have issues with noise, you have issues like pain, dizziness. Some people even have sleep issues. All these symptoms comes under the tip of the iceberg, and it comes under the, first layer of migraine. Whereas the second layer, what I usually see in most of my patients, is a deep and chronic inflammation in their body. This inflammation can be in multiple parts of the body. It may be in the sinus, it may be in the gastric area, gut, or it may be in some other generalized inflammation pattern also. And there has been studies which says that when the inflammation in the body is high, sometimes your ESR levels, like erythrocyte sedimentation rate levels, or even the CRP levels, these both are simple blood tests which you can get it done with the lab. And these tests, or these levels, often are very high. In some of the patients, the inflammation level is high, but the ESR and CRP levels are, even normal or to the borderline range also. It can also happen. So when chronic inflammations are there are only subtle subclinical inflammatory features which is coming out. When there is acute inflammation, on the contrary, we have all the acute features, like sudden changes in the functions of the system, like gastrointestinal irritations will be there. If it is a sinus inflammation, you get like sneezing, coryza, like watery discharge, and severe congestion will be there. But in chronic inflammations, all such symptoms will be muddled. All such symptoms will be covered up, but the pain or the headache will be the most prominent symptom. So that is why we often ignore all these kind of symptoms. And we know that migraine is a neurovascular condition. Neurologist always tells us that it is a neurovascular condition. Yes, it is true. But what is happening in the neurology? What is happening in the vascularity? Vascularity is blood vessels, and neurology is about the nerves. Basically, what happens is there can be inflammations in either of these. And that is why most of the painkillers are anti-inflammatory drugs, or NSAIDs it is called as, non-steroidal anti-inflammatory drugs. And when you take an NSAID and you are feeling better, please understand there is subtle subclinical inflammations going on in your body. And because of the presence of these subtle non-clinical or subclinical inflammations in the body, the person often feels that he has fatigue. He's been tired, after a day's work, or after a day work at home. He or she will be like tired and fatigued, and there will be drowsiness in the daytime. The person will always complain of, I am sleepy, but I'm not able to sleep. And I'm not fresh and energetic. I cannot go around with my friends and do a party or something, because my energy level is so down, my mood is so down. This happens when you have chronic inflammatory features in your body. So in order to find chronic inflammations, there are some tests available in the market, or even you can even try some things like clinical diagnosis. A doctor who is very particular and takes time to spend with you, who takes time to ask you questions, who takes time to, go to the depth of every case, will often tell you that you have some kind of chronic inflammation, and that can be the triggering point to the migraine. So when we try to manage migraines on the first part, we just use some kind of painkillers or some kind of triptans or something like that, and we suppress it for some time, maybe for half an hour, maybe for 5 hours, or maybe for 5 days. But when we go deep, when we go to the root cause of the issue, which is a chronic inflammation, and when we correctly cater to the need, correctly cater to the cause of the chronic inflammation, we get to see that the migraines frequency, intensity, and duration comes down very fast. And most of the triggers of migraine patients are actually triggering their body's chronic inflammation. Like, for example, when you take sweets, when you take spicy foods, when you take some things which you are like allergic to, when you are taking some, exposure to sunlight or exposure to some factors which your migraine is getting aggravated, actually the chronic inflammation inside the body or the symptoms of chronic inflammation is actually getting triggered, and this is going to be triggering the migraine on the second place. And that is how you connect triggering factors with migraine. So there is no point running away from triggering factors. And I have been observing in patients, the common trend in migraine patients is that they fear or they are afraid of triggering factors, and they tend to avoid all these triggering factors. Is there a real factor in all these triggering factors? Please think in these terms. When you avoid a triggering factor, you are just avoiding a chance. You are not putting any effort to cure the chronic inflammation or the root cause. When you're avoiding a trigger, you will often find that new triggers come up in your life. So people always tell me, sir, I avoided sweets, I avoided stress, but something else came up which became my new trigger, and I added that to my triggering list. So the trigger list will go on and on. Once you identify, or once you start to identify each triggers in your life on a day-to-day basis, you will find that there are more and more triggers coming up. Like people tell me that when I take head bath, I'll get headache. When I go out in sun, I get headache. When I have oil my head, it is headache. Like that it goes. And basically you have to understand there is an inside story of this chronic inflammation also. Basically, when I did my deep research in psychology, I came to know that there is a hidden connection between the mind and the body. That is the psychology and the physiology. And it says that when you have chronic suppression of emotions inside your mind, like inside your thought patterns or inside your, like whatever you call as psych, we get to see that there is more chances of getting chronic inflammation. So in psychology textbooks, what they say is, where there is a chronic suppressed emotions, where there is chronic traumatic experiences in the childhood, the child will grow into an adult where the adult will form certain types of chronic inflammations. It can be anywhere in the body. It can be the gut, it can be the sinus, it can be the joints, it can be presented as allergy symptoms. So these kind of chronic inflammations have the root or the, it is chained towards the chronic suppression of emotions. And when we ask the patient about what is the emotional background they're having, what is the sensitivity of their emotions or the psyche they're owning, or what is, how was it for them, to live as a child? How was it for them, past 10 years in their career or in their family life or in their relationship? They always tell me that, don't ask me that, sir, because that was really pathetic. So the ego part of our mind or ego part of our psyche will actually protect us from going to the emotional side of it. And in our society, or maybe our parents have always told us to be bold. Don't show out your emotions. When you show out your emotions, you are labeled as weak in the society. So we don't actually carry around our emotions, or we don't want to talk about our emotions. We don't want to show it out. We always take it inside. And in psychology terms, it is told that when the emotions come out, it comes out as tears. And when it goes inside, or when we suppress the emotions, it goes inside as phlegm. And this phlegm can be the root cause of the chronic inflammation that you're suffering. So I often see that most of the patients have some symptoms like nose block, or some symptoms like heaviness in the head, some symptoms like Their migraine is aggravated when they shake their head. They have more headache when they jump around or they go for a Zumba class. So all these symptoms are actually related to the chronic inflammation around the head or around the sinus. And this can always be tracked back to the suppressed emotions which has happened due to some big or small traumatic experiences of their childhood. So once again, to look back on what we were talking till now, like migraine as a tip of the iceberg, and the first deeper layer is about the chronic inflammation, and the deepest layer can be the chronic suppression of emotions. So it can be a multi-layered or it can be a three-layered structure wherein the painkillers or the home remedies or the techniques of avoiding triggers are only aiming at the tip of the iceberg. We are not actually aiming at the base or the root cause. So what we need to do as a migraine patient, do we need to again go behind the triggers, or do we need to again go for a better doctor who gives us better painkillers, or do we need to understand there are certain things which people often ignore or which medical fraternity often do not relate to, and I will have to go deep so that my body and mind is getting healed. As for a migraine patient, you can start with understanding the body's functions. You can start with observing the things which is happening in our body. You can start with observing the messages which the body is giving you. So every pain is a message the body is giving you. Every inflammation is a message the body is giving you. So if you have some kind of pains, either in the sinus area or in the face, or maybe in the back of your head, or maybe in the neck or the shoulders, please understand that this need not be just migraines. This need not be just headaches, but this can have long-term implications, and this can be caused by long-term emotional trauma that you have been suffering. So whenever you choose a treatment, whenever you choose a management protocol or a treatment for migraine, please understand that it has to be comprehensive. It should not be anything which only targets the tip of the iceberg, but it should also target and heal the internal inflammation as well as the internal pain of your psyche. That is how the relevance of holistic migraine treatment is coming up these days. In this modern world, which is technology driven and AI driven world, we do not actually sit and listen to our messages, the messages which the body is showing you. We do not listen to the messages which our emotions are trying to express. We ignore them, telling that we do not have time or we have better things to do than sit with your emotions and understand them and acknowledge them. Most of the people which I have communicated with are having difficulty even in bringing out their emotions. They do not even have access to multiple emotions which they are feeling. People have often told me that, sir, I am not able to cry or I am not able to feel the joy inside. But all I bring out is my anger. All I get to access is my short-temperedness. So I am getting irritated often. I am getting more short-tempered often due to certain situations or life circumstances or due to my relationship issues. So all these things gives a clue that some of the emotional patterns you are hiding inside need to be revealed out or need to be expressed out. The moment you understand the relevance of emotions and inflammation as a base of migraine, that is where your true healing starts. And that is what holistic healing really works on. If you have been watching this video till now, I am sure that you are just seeking some kind of hope so that your migraine can be cured. You are really fed up by trying out multiple painkillers and you have been trying to find relief with multiple doctors or multiple specialists. So I do not want you to go for doctor shopping, and I do not want you to go and search a new painkiller which can just give you a pain relief for a few minutes or few hours. Instead of that, you should be willing to acknowledge the presence of chronic inflammation, and you should be willing to acknowledge the presence of chronic suppression of emotions which might have happened in your body with or without your knowledge. True healing of migraine happens only when you resonate with the idea that it is to be healed rather than it is to be managed with painkillers. Healing truly comes when you work deep on yourself. And that is where we always tell that migraine is curable.